friends, I am Dr. Shah Hussain Beradar, physician at Khizar Super Speciality Hospital, Vijaypur. Friends, I am back with another topic for the general practitioner, that is diagnosis and management of diabetes. Friends, I am going to speak only limited subject related to the general practitioner. As a clinician, what is needed for them, I'm going to speak. My friends, diabetes is very important topic for as a general practitioner. India is a hub of diabetic patients in the world. Almost 15 millions are suffering from the diabetes. Friends, by the end of 2030, India will become a world's leading diabetic individuals. Almost reach to 30 millions by the end of 2030. So friends, update your knowledge, be skillful in diagnosing the diabetes. You are the primary physician who attends patient first. Patient needs your help, your advice. They come to you frequently. I hope this effort will improve your knowledge and help you in your practice, day-to-day practice. Friends, I'm going to talk about diabetes. What is diabetes? Its classification, clinical features and diagnosis. I will speak only that subject, what is needed in day-to-day practice. As a clinician, you don't require pathology in detail. What you need is what is the disease, what is its etiology, what are the clinical features, and how to diagnose, and you know the limitation. Can you treat that disease in your clinic, or should you refer that disease patient to the higher center or a specialist for the further management? My friends, diabetes mellitus comprises of a group of metabolic disorders that share the common features of hyperglycemia. In a layman language, it is simply called as a disease with high blood sugar level. My friends, now we study the classification or types of diabetes. Type 1 diabetes is characterized by insulin deficiency, most commonly caused by autoimmune destruction of pancreatic islet beta cells. Second is type 2 diabetes mellitus is a heterogeneous group of disorders characterized by variable degrees of insulin resistance. Second, impaired insulin secretion and excessive glucose production in the body, strongly associated with obesity. Obese individuals, the glucose production is more in their body compared to a lean thin individuals. Third is maturity onset diabetes of young, that is called as MODY, caused by a genetic defect in the body, is a monogenic diabetes mellitus. Next we talk about other diseases that causes DM. Out of that, we first speak gastrointestinal diseases. Chronic pancreatitis is chronic inflammatory condition of pancreas. Islet beta cells destruction leads to DM. Next is cystic fibrosis. It is a systemic disease, inherited life-threatening disorder, affects lungs, GI system. Here, thick mucus is secreted that blocks ducts in pancreas leads to diabetes mellitus. That disrupts insulin secretion and transportation results into diabetes. Next systemic disease is hemochromatosis. Iron overload is usually caused by inherited condition called as hemochromatosis. Iron overload in the pancreas leading to a pancreatic destruction and malignancy of pancreas results in diabetes. Next, endocrinal disorders, friends. Acromegaly is the top condition which results a condition where the excessive secretion of growth hormone from the anterior pituitary that results in insulin resistance, hyperinsulinemia and increased glucose production combined to produce a metabolic condition which leads to diabetes mellitus. See, this is a photo of a acromegalic individual where his body is grown disproportionately compared to the normal individual. Next secondary disease is Cushing syndrome. Friends, Cushing syndrome is a condition that occurs from excessive exposure to high cortisol levels for longer time leads to insulin resistance, results in diabetes mellitus. This is the obesity and clinical features suggestive image of Cushing syndrome. I will not speak in detail because it takes long time. Next is a glucagonoma, is a malignant condition of pancreatic tumor. Excessive secretion of glucagonoma from tumor leads to glucagonoma. Glucagon is a single chain polypeptide hormone secreted by pancreatic alpha isolate cells. Glucagon in the liver to increase the glycogenolysis, resulting in an elevation of blood sugar, leads to diabetes mellitus. Next secondary cause is pheochromocytoma. Friends, pheochromocytoma is a tumor developing adrenal glands. Tumor secretes excessive amount of catecholamines and cortisol level, results in insulin resistance and glucose intolerance, leads to diabetes. Next is the thyroid disorders. Both hypothyroidism and hyperthyroid both cause diabetes mellitus. In hypothyroidism, it is because of the insulin resistance and poor uptake from the peripheral cells that leads to diabetes mellitus. Whereas in hyperthyroidism, there is partly autoimmune destruction of pancreatic beta isolate cells and increased production of glucose in the body results into diabetes mellitus. There are certain drugs to cause diabetes, friends. Nicotinic acid, glucocorticoids, thiazides and protease inhibitors used in retroviral disease. They all cause glucose intolerance, insulin resistance and leads to diabetes. Next type is a gestational diabetes, is a condition in which a hormone secreted by placenta prevents the body from using effectively insulin for the metabolism of glucose. Glucose builds up in the blood instead of being absorbed by the cells. Now we speak about clinical features. A lack of symptoms is the main reason for the delayed diagnosis. By the time you diagnose the disease, almost 5 years have been passed because it is a asymptomatic initial days. By the time symptoms develop, the renal threshold has crossed, when the blood sugar reaches more than 300, then patient starts developing symptoms. Till that time, patient remains asymptomatic. You can diagnose the disease when patient comes for some other disease, and incidentally you check the blood sugar and find high blood sugar. In such condition, incidentally some patients are diagnosed. In India, we have very limited number of individuals come for the health checkup annually. So most of the time diabetes remains undiagnosed for longer time, causing almost pathological changes in vital organs of the body. Common presenting symptoms of diabetes are polyuria, that is excessive urination, increase in frequency of urination; polydipsia, excessive thirst; polyphagia, excessive hunger may or may not be there; weight loss, fatigue, weakness, blurred vision in long-standing diabetes leading to a retinopathy; frequent superficial skin infection, especially patient is suffering from fungal infection, recurrent fungal, you must suspect diabetes; patient with poor wound healing, then you must think of diabetes; paresthesias, patient complains of altered senses in the tingling, numbness, burning feet in the night time, then you must think of diabetes. Now the biggest part of the discussion is when to diagnose and whom to label as a diabetic. Now we follow the American Diabetic Association guidelines. What are the criteria for diagnosis of DM? Friends, symptoms of diabetes mellitus plus random glucose concentration more than 200 milligram per dl in one or many occasions, or fasting blood glucose more than 126 mg per dl, or 2-hour plasma glucose level more than 200 mg per dl during an oral glucose tolerance test, or HbA1c more than or equal to 6.5%, then we label that or diagnose that individual as a diabetic. Now I'll speak about general management of the diabetes. I will not speak about the treatment because it becomes longer. I speak the complications and treatment part in next lecture. General management of diabetes includes a medical care for patients with diabetes, individualized glycemic goal and therapeutic plan. My friends, glycemic control goal and therapeutic plan differs from younger individual to a older individual. We expect a strict glycemic control in younger individual with strict adherence to diet plan, whereas in older individuals we become little liberal, a glycemic control little on higher side, we accept it because recurrent hypoglycemia is the potential threat to the older individuals than the diabetes itself. We encourage patients or educate patients to self-monitor their blood sugar at home with a glucometer. It becomes easier for the physician to treat when they come for the follow-up. Frequent HbA1 testing at least 2 to 4 times annually. Friends, fasting and postprandial blood sugar reveal that day's sugar level, whereas HbA1c gives us average plasma sugar in the past 3 months. So we advise HbA1c at least 2 to 4 times annually. Now lifestyle management, it is very important in general management. We advise every patient to go for a medical nutrition therapy, to consult a good dietitian, to have a diabetic diet plan. Next, physical activity is very important for the diabetic patients. Friends, we advocate mild to moderate aerobic and anaerobic exercises. And next part is very important, we should take care of is psychosocial care. Friends, when they are diagnosed, most of the individuals either they go into depression or becomes anxious. Both are difficult factors in getting glycemic control. Please address this both the diseases as possible as earliest. If you do not treat either depression or anxiety, both leads to a poor glycemic control. Next, detection, prevention or management of diabetes related complications like retinopathy, ischemic heart disease or coronary artery disease or peripheral vascular disease or neuropathy to prevent the foot or extremity injuries or burns. Next is advise the patient to go for eye examination at least annually, foot examination, and kindly rule out neuropathy or nephropathy to halt the further destruction. Manage or treat diabetes relevant conditions like high blood pressure, dyslipidemia, and consider adding antiplatelet therapy. Now, in general management, very important as a general practitioner is to advise patient regarding diet, what to take, what not to take. In diet, advise patients high fiber, low carbohydrate diet. Advise patients to take pulses, all vegetables except sweet potato, fruits in a limited quantity, especially when it comes in seasonal fruits. A patient can have a slice of mango or a slice of watermelon, a slice of orange. Patient can have one apple a day or one banana a day. And whereas in food, patient can have seafood, fish and red meat without fat, all vegetables, tomato, pulses and dry fruits, almond, patient can have. And what not to eat, you must not forget to advise the patient. Don't eat high sugar content soft drinks, ice cream, cookies, cake, biscuits, fried items, bread, bun, etc. Friends, last but not least, very frequently asked question, can a diabetic individual have jaggery? Many doctors do advise to have jaggery. My friends, I would like to ask them, what is the difference between jaggery and sugar? Some people have a misunderstanding that sugar is the only disease, food that causes diabetes. No, friends. Jaggery and sugar are made from sugarcane, from the same source, only the mode of preparation is different. Whereas jaggery contains some amount of vitamins, minerals, especially it contains iron. It is good for the anemic patients suffering from iron deficiency anemia. And jaggery also contains carbohydrates, whereas sugar also contains carbohydrates. When you eat both jaggery and sugar, they are converted in the body simple glucose form. 100 gram of jaggery contains 10 to 15 grams of sugar, glucose. This potentially it does harm the diabetic individuals. Please advise not to have the jaggery or sugar, either of two. Friends, it hardly makes any difference whether you have jaggery or sugar. Please do not advise anyone to have jaggery. If at all they are having, please ask them to stop it. Hope my effort has reached the goal. Thank you for watching. Next time, in next part, I'll come up with complication of diabetes and its treatment. Friends, I'm treating diabetes past 20 years. All patients are happy. None of the patients are suffering from any complications of the diabetes. They are well controlled, following the diet plan. However high sugar level may be, I'll get it controlled in a week time. Please guide your patients. Please save their lives. Thank you very much.